Okay, so a fellow physical therapist extraordinaire, PT friend of mine, made a request for me to discuss certain exercises for pelvic floor muscles. These are muscles that men and women have, can cause a lot of problems throughout our lifespan, whether we're older, younger, whatever. And there are certain exercises that can be done. They are colloquially known as the Kegel exercises. They are not discussed very often. The problems associated with having weak pelvic floor muscles, not discussed very often. And there are problems with having, we call it hypertonic, which means that the muscles are too tight. So I'm going to discuss a little bit of the anatomy in a very general sense. I'm going to talk about gravity assisted versus gravity resisted movement and gravity eliminated, which I haven't discussed with some of the other exercises I'm doing, because in all of those I'm actually using more body weight resistance. So I haven't really worried too much about talking about whether or not we have gravity involved, because gravity has been. So any questions coming from this video, feel free to ask me and I will try and explain again in as easy terms as possible. So the first thing I just want to discuss is the pelvic floor muscles themselves. So these are those very deep muscles that are primarily responsible for holding back your urine and your feces. So when we have incontinence, whether it's bowel or bladder incontinence, quite often it is linked, at least in part, to having these muscles be too weak. They are also the reason we find it slightly awkward to talk about them. Is these are the kegel muscles. So these are the muscles that are sometimes used in intercourse for women, especially, to provide an increased contraction, which can help with better feeling on both ends. So talking about them is something that it's not really taboo, but it's more just, we don't think about it, we don't want to talk about it, we don't, it's like I said, a little awkward. But these are muscles just like the rest of the muscles in our body. They are actually voluntary muscles. So I can specifically request this muscle to move by sending a message from my brain down to the muscles and get a contraction. The difference between these and, say, my bicep is I can see the result of me contracting my bicep. I see my arm moving. There is a large gross movement that happens when I contract that muscle. With the pelvic floor muscles, if I'm doing it correctly, I don't see anything externally. I have, because Facebook, of course, decides to troll me, seen advertised certain products that give what we call biofeedback. So basically it has some kind of device that sends a notice to your phone saying whether or not you're contracting them. And so you can do like games and stuff, and when you squeeze correctly, it causes your figure to jump or whatever on the game screen. So there's certainly that kind of very more advanced biofeedback. If you go to, there are health specialists, physical therapy specialists, women's health specialists, doctors, PTs, there are many there that can use very specific, it's like electrodes and much more complex biofeedback that does the same thing. It basically tells you when you're using those muscles correctly. Like I said, these muscles, when they are not working properly, tend to cause problems with incontinence. So ideally, if my pelvic floor muscles work correctly, when I have the urge to urinate, I contract those muscles and that holds it in until I'm able to get to the restroom. If those muscles have weakened over time, then you might have what we call dribbling or other episodes of incontinence, or you just have its floodgates open, and that's when we get to the incontinence pads and other things like that. So that's the problem with weakness, and weakness can happen. It's very, very common with women who are either pregnant or recently pregnant. All the changes that happen to your body during that pregnancy, that can cause a lot of weakness in those muscles. So it's not uncommon to have these incontinence problems because of the pelvic floor muscle weakness after pregnancy. Also, depending on what kind of birth you gave. So a vaginal birth where they have to do, I can't remember the term for it, but where they basically enlarge the vaginal opening, what they have to cut through are some of your pelvic floor muscles. So if they do that extra surgical excision, you are going to have damage to your pelvic floor muscles. So you, again, are going to be even more prone to having weakness in these muscles. As we get older, obviously, you know, we lose muscle tone in general throughout our body the older we get. And if we don't work our muscles, they get weak. So you can see some very fit 80-year-olds that can, you know, exercise me under the table, out into a corner, whatever. But you also see some 50-year-olds that are barely getting around. And part of it is how much you can do. And obviously there's other problems like arthritis and health conditions that can limit our ability to exercise. But generally speaking, we naturally lose strength and muscle tone as we get older. If we don't continue to exercise the muscles, then we're going to lose more than we would if we try and use exercise to prevent that muscle loss. These muscles are just like every other muscle in your body in that you are going to lose muscle tone, and when that happens, then you can end up having problems again with the incontinence. It's the most common one. There is a flip side to this. So what can also happen is if you have hypertonic muscles. So if the muscles are constantly contracted and constantly squeezing and constantly activated, whether it's spasticity or just your own nervous energy, or you know, you think that 1 kegel is good, so 20 is even better, whatever the problem is, sometimes you can actually cause that hypertonic reaction, which can cause difficulty urinating. So you go to urinate and you end up having to spend more time there because there's a contraction which cuts the urine off, and you have to wait for the muscles to relax. That's usually a muscle spasm. Or you think that you've urinated all the way, and in reality, those, again, the pelvic floor muscles contracted and it stopped the urine, and then you end up having to go again very soon after because you didn't completely empty your bladder. It can also cause problems with discomfort in the vaginal region during sex or throughout the day. So that's another thing that it's not uncommon and it is not very talked about. So that's a lot of general history of pelvic floor. So like I said, it's a very important muscle that doesn't really get discussed very often. It's not something that you're going to see when I do my pelvic floor contraction, which I honestly have been doing throughout the discussion. You haven't noticed any difference because, again, it's not an external muscle that you can see the movement. So it's very difficult to teach in that regard, in that we're used to seeing an obvious contraction, feeling an obvious contraction, and you don't necessarily get that. Especially if you have weakness in these muscles, you're not necessarily going to feel a large contraction in them versus if you're just doing them as a regular routine exercise. And again, that's when you know, women who talk about doing their kegels, they do their exercise, pelvic floor contractions on a daily basis. They can feel more of a movement when they're activating versus not activating because they have more muscle tone. So again, just needed to kind of go over a lot of the general things about it. So moving on from the muscles themselves, I'm going to talk briefly about gravity assisted, resisted, and eliminated. So by that we basically mean the plane of movement that my muscle is activating in. So I'm going to go back to my bicep because, again, we like obvious movements. We like to see a movement. So if I bring my arm out to my side and I bend my elbow, I'm contracting my bicep. I'm bringing my forearm up against gravity. So I'm using gravity to give me the weight of my arm as resistance for my bicep muscle, okay? If I want to have gravity assist my movement, I'm going to be basically doing a tricep press. So when I'm going up, I'm I'm working against gravity for my tricep, and when I'm going down, I'm allowing gravity to assist the movement of my bicep. It's a little bit, basically it's eccentric versus concentric contraction, which is really more than you need to know. So anyway, depending on how I position myself, I can either use gravity to give me more resistance or make it a little bit easier for me, or make it really easy for me. The way that the pelvic floor muscles sit in our body, so it makes kind of a sling. So they're kind of sitting at the bottom of my pelvis, and when I contract them, they pull up. When I relax them, they hang down in that kind of hammock sling position. So really and truly, to give myself a gravity assisted position, basically I would have to do all the exercises on my head. I personally have things that I can do inversions with, so I could theoretically do an inversion and have it be a gravity assisted contraction of my pelvic floor muscles, but most people don't have that, and it's not really very comfortable and feasible to sit there and do pelvic floor contractions, and then you're going to have a whole bunch of other stuff going on. So gravity resisted means if I'm doing my pelvic floor contraction in a seated position, so just sitting here, I'm asking my pelvic floor to contract up and then relax. So I'm moving it against gravity, okay? Just like with the other exercises, if I change the surface that I'm on, it is going to change the difficulty of the exercise. So right now I'm on a hard, well, slightly padded, but generally a more firm surface. So it's not a lot of movement underneath of me, not a lot of difficulty. If I were to sit on my physio ball, which I will do a little bit later, that's going to add a different component to it, make it slightly more difficult to do these exercises. If I want to make my life a little bit easier, what I'm going to do is lay on my back to do these exercises. So again, if you think about having that sling down here, when I've got that sling contracting up and down here, it's against gravity. Well, if I bring my body to horizontal, now when I'm contracting them and bringing them up and down, gravity is not working against them. Gravity is pulling this way, the muscles are pulling this way, and therefore I'm in a gravity eliminated position. So when you're first starting out with your pelvic floor muscles, your easiest thing to do will be put yourself in a gravity eliminated position. So that's going to be on your back. You can bend your knees, you can keep your knees straight. It's really more of a comfort thing. If you have back problems, you're going to want your knees bent. So the contraction itself, basically the way that it was discussed with me, I took a women's health class just because, like I said, it's an important exercise, and every now and then I run into people that do have problems with, well, actually quite often I have people with incontinence issues. So it is something that it's important to know how to discuss to contract. So in the women's health class, they talked about thinking about if it's an elevator. So your pelvic floor muscles are an elevator. We're asking that elevator to raise and lower. And in the beginning, all we want is a little bit of a movement up and down. And I want to control that movement. And ideally, I want to be able to get to the point that I can say, all right, we're going from ground floor to second floor, third floor, fourth floor, and back down. And I want to be able to control the level of contraction and the level of relaxation. So I did say that because these are internal muscles, you're not necessarily going to see any external movement. However, we do have a muscle in our abdomen that quite often when I contract my pelvic floor muscles, especially if I'm doing a very strong contraction, really trying to lift them up, I'm going to get an additional contraction in this muscle. So this muscle is my transverse abdominis. It's not the one that makes the six-pack. It's not the one that helps with your love handles. It's a muscle that just is responsible for compressing our abdomen. So when I activate this muscle, I'm going to be going from my flabby belly to my beach belly. This is my cold water just hit my stomach, I'm sucking in my belly, or I'm walking in a bikini and I'm feeling self-conscious, pulling my belly button towards my spine. Okay? So I'm not doing a crunch, I'm not moving anywhere side to side. All I'm doing is pulling my belly button slightly in towards my spine. That's my transverse abdominis muscle. So there is a neuromuscular link between these two muscles. So theoretically, when I ask my pelvic floor muscle to contract, I may end up getting that TA contraction as well. So if you were watching me as I was doing, especially the elevator version where it's a control the amount of movement and doing a larger contraction, I did squeeze in my TA, and that just kind of happened without necessarily a conscious thought. It just made my life a little easier, and so that's what I did. So you can try that. People have problems finding their TA muscle as well, so it's not always effective. A really good time if you're really struggling with figuring out how to make this muscle work, how to get the contraction correct, and you don't enjoy the idea of biofeedback because it's awkward, what you can do is when you go to urinate, this is something that men do because I have no idea why, but 90% of my male patients, if I ask them, have you ever decided to cut the stream when you're urinating? They're like, oh yeah, I do that all the time. I don't know why. Women, we don't do that because that's just weird. So men, y'all are weird. Anyway, it is a good way to practice a Kegel exercise, and if you are doing it correctly, you will have a stop and a start in your urination. So again, when you're first doing it, you might notice that you're just going from a full stream to a trickle, and that means that you are still activating the correct muscle. Obviously, when we're doing it, we have a very limited amount of time, depending on how full our bladder is, to be able to practice it, but it is a good way to kind of get a feel for what it feels like internally when you're activating the muscle correctly. So if you notice a change in your urination while you're urinating and you're attempting to contract this, then you know you did the correct thing, and you can go ahead and continue to practice that on your own afterwards. So that's a way to give you a little bit of, again, that biofeedback. So you do something, then there's a response that tells you whether or not you're doing it correctly. If you think that you're contracting and you're squeezing and squeezing and squeezing and it just goes out harder, that means that what you're actually doing is you're bearing down and you're increasing your abdominal pressure and pushing instead of holding. And so that's something that you want to avoid. It's one of those things that we talk about when we're having a bowel movement, you know, bearing down, squeezing, that kind of thing. It's not the same muscles being used, and it's not what we're necessarily looking for. So if you're having an increase in your urine stream and pressure, then that means you're using the wrong muscles, so keep on trying. But that is one way to be able to practice it in, you know, fairly feasible way. And see whether or not it's working. So I'm going to show you the positions to make it a little bit easier and a little bit more difficult. And I'm going to do a couple of them. And again, you may or may not, if you're watching my TA, you might be able to see a little bit of my belly contraction when I'm doing them. But other than that, you're not necessarily going to see a lot of movement. And I will try and discuss and again, kind of use my finger sling to really give you a visual cue to what the movement should be. Okay, I'm going to pause it for a second because I need to adjust the camera so that I can lay down. So, okay. So, like I said, when I lay down, whether I'm with my knees bent, technically this is called a hook lying position, or my legs flat, it's mostly a matter of comfort. I have back issues that gets really uncomfortable for me, especially on a very flat, hard surface. This does make life a little bit easier in contracting them because it kind of tilts your pelvis into a more neutral position, which is going to make, because they are attached to your pelvis, it makes it a little bit easier for me. And you can toy around with it, figure out whether it's easier or harder for you. So, again, here's my pelvic floor sling. I don't know how well you can see it. So all I'm going to do is ask the muscles to contract slightly and go first floor, second floor, third floor, and fourth floor. And again, as I get that stronger contraction, I do tend to do the TA contraction as well, because that's the easiest way for me to get that full contraction, okay? And again, with the relaxation, I want to try and relax a little at a time and bring those down until I'm fully relaxed, okay? And that's really all it is. Again, if you have problems in the opposite manner, if you have hypertonicity, if you have too much strength or too much tone or spasms in your pelvic floor muscles, you don't want to do these necessarily unless you're really focusing on the relaxation part. So you may end up squeezing more just to get the idea of this is an active contraction and I need to let it go, and then try and relax more beyond what you did, because typically what is happening when you're having those excessive spasticity or tonicity is those muscles are overused and you're having a hard time relaxing them consciously and subconsciously, and you need to be able to, and that will help. So if you're having those problems, I would strongly suggest talking to a women's health professional, whether it's a physician or a physical therapist if you can find a specialist, and they can give you more exercises to help with it. Again, while it's not talked about very often, these are very, very common disorders, both the hypotonicity, which can cause the incontinence, as well as the hypertonicity, which can cause discomfort and difficulty with your urination and urinary retention. So that's the gravity eliminated position. So again, I'm not working against gravity because my pelvic floor muscles are working in this plane and gravity is pushing down towards my belly button. So this is the easiest position for me to be in to do my pelvic floor muscles. So the next position would be a sitting position. So either sitting on a chair, you can do it kneeling if you feel like. I'm lazy, I don't feel like grabbing the chair back out. Again, my pelvic floor muscles, I'm going to ask to go up, 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 relax, 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 and let it completely out, okay? Now I have them pulling up against gravity. So they are, and we're not talking just gravity in this position because we're also talking about the internal structures that are being pushed by gravity further into the pelvic floor, and those are being now lifted up by these pelvic floor muscles. There are some very severe, which, sorry, it's a tangent, but that reminded me, there are some very severe things that can happen if your muscles get too weak, and that's called a prolapse. So you can have basically those internal structures start falling out because the pelvic floor muscles aren't able to keep them in. So again, very important muscles, really can have a huge impact. Don't be afraid to ask somebody about them if you're having problems with them. All right, so the last position that I'm going to be in is going to be sitting on a physio ball. So in this position, I'm going to have a more dynamic surface under me, more dynamic surface underneath the sling muscles. So this is going to be my harder position to be in, okay? So again, up, 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 down, 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 and relax, okay? And if you really feel adventurous and you want to try and take it to another height as far as difficulty, then try and maintain a contraction in your pelvic floor muscles while bouncing on the ball. So that's going to give you, again, my inner organs are going to be bouncing up and down with this movement and pushing against the pelvic floor muscles throughout. So you're giving extra resistance to those muscles. And again, that's if you're feeling especially strong and especially adventurous, you can try that. and really try and hold it for a length of time. I wouldn't do more than 5 to 10 seconds and then let it relax. So as far as the muscles themselves go, they are a supportive muscle. They're a stabilization muscle. So they're meant to have a certain level of resting tonicity. That's why when they're not working correctly, you can have all those extra problems. And then they're also supposed to have a certain level of active tonicity. So if I ask these muscles to contract, I'm going to get this extra movement. So again, I feel the urge to urinate. I squeeze these muscles while I book it to the bathroom. And then when I get to the bathroom, I actively relax them and let it release. So they have a different combination than a lot of our muscles don't necessarily play that same fine balance between stabilization and active movement. And these really do. They have a very important role in, again, the stability of our internal structures, preventing a prolapse by having that resting tonicity, not having too much tonicity because, again, that can cause pain, and then having that active contraction to help prevent urinary incontinence and also fecal incontinence. So we really want to make sure that we can do both, that we can have a held contraction, but also control our contraction. So that's why the elevator method kind of works, because we're thinking about trying to go up, 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 down, down, down. We're controlling the amount of contraction. We're doing a small to large contraction and releasing that large to small. So again, we're getting that relaxation component, which can be important, but we're also getting that control of how much contraction we have. And then again, trying to practice it with a hold. So I wouldn't necessarily hold at the full contraction because that's a lot of contraction and muscle to be asking. I would be personally level 2 or 3, just a little bit of an elevation in our pelvic floor muscle. Try and hold it for 5 seconds if you can. If you feel like it is loosening and relaxing a little bit unconsciously, that's normal. That just means that the muscles aren't quite strong enough to hold it for the entire contraction, and you just try again and do that until, and eventually you will find that you can do that contraction for a full 5-second hold. So that is the pelvic floor muscles, also known as kegel exercises, and a little bit of the anatomy. And I'm sorry that it was a very long video, but there's a lot going on in that whole bucket of worms. So I hope you enjoyed.